We continue our segment for the children this morning. Today we are discussing a deadly disease that strikes swiftly and can attack any child, teen, or adult without warning. Dr. Lee Scott joins us this morning with more information on Reye's disease. Dr. Scott, thank you for coming by.
Sure.
Reye's disease is not something that I've heard of before. Can you explain to us what exactly it is?
It's something that arose in the late 70s, early 80s. It's a syndrome that is an association of using aspirin along with a viral illness in children, especially chickenpox or most importantly flu. And that prompted the recommendation back in the 80s of the CDC, the FDA, the Surgeon General, and the American Academy of Pediatrics to not use aspirin in anyone under 18 except for very specific reasons as directed by a doctor because of this association. Reye's syndrome hit its peak in the early 80s with about 500 cases in the United States. It affects the brain and the liver and causes brain swelling. That's the most damage and unfortunately is often fatal.
What about medications that contain aspirin but maybe are not pure aspirin in itself?
Those are to be watched for too. A lot of people don't realize that salicylates, which are aspirin-like, are in some other products. The most prominent example is probably Pepto-Bismol.
I actually know that myself, and I have an allergic reaction to aspirin, and it's a scary thing to realize how many different prescriptions aspirin is actually in. And now, what about with these symptoms? If someone could possibly have Reye's disease or have symptoms of Reye's disease, what should parents look for?
Usually a few days into the viral illness up to actually a few weeks after it's over, usually starts with vomiting that becomes more and more, followed by restlessness, lethargy in the child, leading to confusion. If these things should develop, they should see a physician fairly quickly.
Now that was my next question. What would a physician do at this point? Is it something that is curable if you do have this kind of reaction?
There's not a cure or medication, but if it's detected early, supportive measures can be taken to reduce swelling of the brain.
So once again, to prevent this from happening or from contracting this, the best thing to do is to avoid aspirin before the age of 18?
Absolutely.
And as far as the other medications, if they do have aspirin in it, what's the best thing to do then? Just
avoid them. Use alternatives, check with your doctor if unsure. For fever, pain control, for flu, ibuprofen or acetaminophen would be the things to use.
And going forward, is this something that you see frequently, or is it something that's more of a rarity?
Fortunately, it is more of a rarity, but in this flu season I have heard from a number of parents that they were treating their children with aspirin, and it's been so long since we had the peak in the early 80s, these parents simply had not heard of Reye's syndrome. So it's something that everyone needs to be reminded of from time to time.
Great. Dr. Scott, thank you for coming by with this very important information.
Thanks.
And if you have any questions for the children, email us. We'd love to hear from you. It's morning@WTVY.com. And remember, you can watch this and past interviews on our web channel, WTVY.com. Just click on For the Children.
And stick around. I've got a final look at your